Hey everyone, it's Nurse Sarah. So as a nurse, you are going to encounter those difficult patients. And in this video, I want to share some of my experiences with these patients and tell you how I dealt with them. So first, I had only been a nurse for a couple months up to this point, and I was receiving a report from the night shift nurse, and they were warning me that I was about to get a difficult patient. And this patient had been causing trouble for everyone, all the nurses and doctors. They were just completely unhappy with their care. They wanted to go home. They were just very difficult to talk to and deal with. And this nurse was just warning me that, hey, you're probably going to have problems out of this patient. So after I heard this, I'm thinking, great, here we go. I get my first real difficult patient, and hopefully I know how to deal with this. So I go into the patient's room and I introduce myself, trying to have that icebreaker so you can establish good rapport. And that patient was not having it. Right off the bat, I could tell that that nurse was right. The patient was unhappy with all the nurses and doctors, the care they were receiving, just constantly complaining. And I could just feel the tension in the room, and you could just literally cut it with a knife. And even the patient's spouse was sort of just trying to calm the patient down. Now, whenever people complain, there's usually a reason for it. And you want to dig deeper and find out, okay, why is this person acting this way? Maybe it's something I can solve. So I try to think back to, the communication class that I took in nursing school, and I'm thinking, okay, what can I do with this? Because I'm a new nurse, I'm trying to figure out how to deal with this because I don't have a lot of experience at this point dealing with patients like this. So I think back to, those open-ended questions. I'm going to ask one of those, and maybe that'll help me dive a little bit deeper into why this patient's unhappy. So I asked something to the effect of can you tell me what's making you feel this way? And after I asked that, it's literally like something just clicked. And the patient all of a sudden opened up to me. And the patient started talking about how they were feeling like we were hiding stuff from them. They didn't know what was going on. They were really confused. And they were just extremely frustrated. And I was like, that is something I can fix. I can help you understand what's going on. So I decided to just sit down with the patient and show the patient what was going on. I went over their labs, their diagnostic report, the physician's plan of care, and what we were trying to do with the patients, the new medications, why they were prescribed, why the patient was having to take them. And once I took those few minutes to explain all of this to the patient's demeanor completely changed. And the patient actually told me, you are the only person who has actually taken the time to sit down and explain this to me. And this patient was so happy that I did this that the patient actually started to become very happy, very easy to work with, and told their spouse to go out and buy me a little gift. And the patient's spouse came back with this absolutely adorable fall decoration that I still have today. And this is 14 years later. So it's really ironic because this is the first gift that I ever got from a patient, and it was from someone who was supposed to be a difficult person. So it has a lot of meaning to me, and every time I put it out during the fall, it just reminds me of this person. So the big takeaway I learned from this experience as a new nurse at that point was that communication is very vital with your patient. So just because you're receiving a report that this is a hard, difficult patient, you need to go in there with fresh, new eyes and just say, what can I do to maybe make this situation a little bit better, and try to dive a little bit deeper and communicate with your patient by asking those open-ended questions. And sometimes it's just a very simple solution, like how it was with that scenario. Now, are all patients going to respond that way that I just went over? The answer is no, because every situation is different, and some patients have more complex things going on that you just can't easily fix. For example, some patients can be under the influence of substances, or they can have a mental health problem going on, or they have some type of neurodegenerative disease that it's affecting their ability to communicate, respond, and function. And open-ended questions don't always work for that. For example, on another occasion, I was receiving a report, and the nurse was telling me that the patient I was about to receive had a history of violence and some mental health issues, and they actually had a sitter in the room. So whenever I went in the room to introduce myself and do my head-to-toe assessment and all that stuff you have to do, whenever you're getting a new patient, the patient was fine, they were friendly, everything seemed okay. So I'm like, okay, good, maybe this is going to be a good shift. But as the day went on, the patient started showing signs of aggression. So before I could really do anything like contact the doctor to report this aggression, all of a sudden I see this patient standing up. They have ripped everything off. They are just in their underwear and they're standing at the doorway with this look of determination in their face. And this person is very tall and bulky. It's not someone that you could just like say, go sit down. They're very intimidating looking. So all of a sudden, without any warning, this patient just darts out of the room and they start running down the hallway. And this hallway is a very long stretch of hallway. Whenever you look down it, it looks like it's like a mile long, but it's because it connects to another wing. So here's my wing and then another wing of the hospital. So this patient just all of a sudden is running down through there, and they're a big bulky patient like I told you. And it reminds me of a scene from Jurassic Park. You know when T-Rex is like in the jungle and they can hear him coming and it's like boom, boom, boom. That's what it sounded like. So this patient is just running super fast down this hallway. So I'm like, oh no, I've got to get that patient back. But physically, I can't do it. So I get on the phone immediately and I call security because that's what we're supposed to do in circumstances when that happens. So as that patient's running, luckily he's going to that wing of other stretch of hallway, and a male nurse who is about the same size as the patient sees the patient. Actually, the male nurse told me he heard the patient, you know, the boom, boom, boom running down, was able to get the patient and bring the patient back to me. And the patient, which I was shocked, was actually calm. I think it was because the male nurse intimidated the patient and brought the patient back to me. And so security came, but they were a little bit too late because I already had the patient back. And we were able to call the doctor. And the doctor arrived and was able to treat the patient, and everything was smooth sailing for the rest of the shift. So the big takeaway from this is that open-ended questions would not have worked with this patient. It might have actually put my life in danger. So with this, I had to utilize other resources. I had to call security, I had to use another nurse, and I had to get the doctor involved. So whenever you're dealing with a difficult patient, you're just going to have to realize that every situation is going to be different, and you're going to gain experience over time with how to deal with these situations. And the big thing that you really want to do is you want to make sure that whenever you have those really difficult patients, like in my last scenario, that you know your facility's protocols and who you need to reach out to help you deal with those situations. And also, don't forget that you want to make sure that you are documenting everything very thoroughly, that you're including every little detail, your action, who you've contacted, and the result, because you want to make sure that you are covering yourself in these situations. And if needed, that you're involving charge nurses, other nurses around you, and even your nurse manager. Okay, so that wraps up this video, and I hope it helps you for whenever you do encounter those difficult patients and how to deal with that situation. And thank you so much for watching.